Many clients have questions and concerns about the use of pain medications for their dogs. They're concerned about getting side effects. If you go on the internet, you'll find lots of very disconcerting information, especially about Rimadyl, which was the first of the modern non-steroidal anti-inflammatory drugs that we had come on the market in the late 1990s. These drugs, again, people have a lot of fears about them, but they're actually way safer than the drugs that we used to have. They're safer than a lot of the older human products like aspirin and ibuprofen, much less likely to cause stomach upsets or diarrhea. There's the actual risk of liver failure from Rimadyl, which is what you'll read about online, is 1 in 10,000 dogs. The other 9,999 are going to not have a problem at all. And even the dogs that do have some liver issues, as long as we're careful to check some blood work periodically after they start on the medication and then every 6 months after that, we'll catch problems early. And if we just stop the medication, those problems are going to go away. Most people with arthritis are on these drugs for years and years and years, and the same is true for dogs, and most of them tolerate them very well. The key thing that non-steroidal drugs do that no other class of medications do is reduce the inflammation inside the joint. Arthritis is an inflammatory process that slowly degrades and damages the cartilage. You can put a dog on pain medication and that will make them feel better, but it won't stop that inflammatory process. Only those NSAID drugs will do that, and so they're the most important drugs to give your dog when they have arthritis. And there's 6 or 7 to choose from, so usually if we just try a few, we'll find one that works well for a particular dog without causing any nausea or diarrhea or problems, and then we monitor their blood work a couple times a year and make sure we're not having any issues. These drugs are more likely to cause problems, especially with the kidneys, if the dog is dehydrated or shocky with low blood pressure. So if your dog ever becomes ill with something else, you want to stop giving the NSAIDs for a day or 2 or 3 until whatever the problem is cleared up, so that you don't end up with any kidney issues. Other than that, again, these drugs are well tolerated by most dogs, and they make their golden years with arthritis way, way more comfortable, and they'll often live longer because we're, again, slowing that cartilage damage down so that it takes longer for them to get to the point where they can't get up and get around at all. We don't want to get to that end stage. We want to keep that dog comfortable for the remainder of its life.